The next thing I'm going to teach you is I've switched on to the convex probe. So I'm going to teach you on how to do measurements on the obstetric exam. So I'm going to press transducer and it's going to show me different packages. So sort of like presets. So I'm going to choose obstetrics, and then I'm going to choose obstetrics 1, 2, or 3. So I'm just going to choose the obstetrics 1. And let's say that this is an image that I have captured for the CRL and the gestational sac. I'm just going to freeze it, press on the measurement button, and you will see that on the side it populates GS, yolk sac, CRL, unibiparietal diameter, femur length, and AC. If I need to do that, so I just simply take my cursor, go into the gestational sac measurement, and just use the set button to set one area and the second one right here, and you can see that automatically generates the gestational sac. Now I'm going to move my cursor, and let's say I have the CRL on this picture as well. I'm going to bring it back, take the CRL to 8 weeks 2 days, and that generates my CRL. Now if I want to check how old is the baby, I will press on the report button, and you will see that it generates a report telling me that the GS is this much and it equaling to 8 weeks 1 days. LMP, of course, I hadn't mentioned when I was generating the patient, but it gives me the estimated date of delivery by ultrasound on 9th of June 2021, and the exam date is right here. So if you put the LMP, it will generate the LMP here on the first patient. In order to put the LMP, if let's say you forgot, you can go back into the patient, which of course you have to do first once you're beginning the patient, and put the LMP here. It's saying like either in vitro fertilization occurred on this date or the last menstrual period was in this date. So let's say the last menstrual period was on September 10th, 2020. It automatically gives me the gestational date that the fetus should be 19 weeks 5 days. And you can press register. Anytime you enter any information in here, you have to press register, so the system registers the information. And then when I go back into the report, you can see that it generates saying that the LMP was this. According to the LMP, it's 19 week 5 days, but according to the ultrasound I did today, it's 8 week 1 day. So EDD by LMP is this much, EDD by ultrasound is this much. Okay. And these will auto-populate once you're doing the second trimester. And there's different options in here. You can do preview, so it'll generate a report like this as well, which can be replaced as a worksheet. You can generate graphs for all sorts of things when you're doing obstetrics, or you can do an anatomical survey, and you can just basically, these are just extra functions that in the machine, that if you see lateral ventricle, you can just write normal and just take an image of that, and it automatically populates in there as well. Okay.